So I'm going to talk about atrial flutter. So the difference between atrial flutter and fibrillation is the impulse sign. So in atrial fibrillation, remember we had multiple points for that new pacemaker. In atrial flutter, we have a single point. So it's not coming from the SA node, but it's coming from a single point within that atria. So let's just say it's here, and again, it's determined by how many impulses the AV node actually lets through. Another difference is this fires on a regular basis, so it will always be firing at a regular pace. So let's just say it will fire 3 times before 1 is let in. So we'll go fire, rejected, fire, and then 1 will go through. We'll call this a 3-to-1 ratio. So this comes over to determining rate for atrial fibrillation. So unlike other rhythms where we have to manually count the rate, this one is determined by that ratio, so how many are let in. So our atrial rate, we always just say it's 300. This is just for atrial flutter, 300 beats per minute, because this allows us to determine the ventricular rate. So the ventricular rate is always going to be 300 divided by the number of flutter waves we have. So just for example here, if we have 3 flutter waves for every QRS complex that we see, which is a 3-to-1 ratio, the rate will be 300 divided by 3, because that's the number of flutter waves we have, and that will give us a ventricular rate of 100. So some key features of atrial flutter is the first thing you'll see is these sawtooth flutter waves that we call, and they literally look like a sawtooth, and you'll see them straight away. So each of these is that impulse going through. Because of this, the rhythm is always going to be regular. And because we have these flutter waves present, there's not going to be a P wave and there's not going to be a PR interval. And the other thing is, like we discussed, is the rate is going to be ratio dependent, so we must determine how many flutter waves there are to every QRS complex and then do this rate calculation for the ventricular rate. Interpret this rhythm strip here. So straight away we can see that it has a sawtooth appearance, so it should be an atrial flutter rhythm. So let's look at the regularity. So we can see the R to R intervals are pretty similar, so let's say it's a regular rhythm. Now rate, we don't count it the same way like we would usually do. We have to use the ratio method. So here we can see this is actually a flutter wave here. It's just buried a little bit in this QRS complex. So this is 1, 2, 3, 4, and then a QRS. So this is a 4-to-1 ratio. So we do 300 divided by 4, which is 75. So this is a ventricular rate of 75 beats per minute. Now, because we have these flutter waves, there's no P wave, there's no PR interval. Let's check the QRS. So QRS is narrow, pointed, less than 0.12 seconds. So our interpretation of this rhythm is atrial flutter at a ratio of 4-to-1 at a rate of 75 beats per minute.